1 in 10 people it has autoimmunity. Why is that? It's because we're nutritionally deficient. We can't maintain our energetics. When our energetics aren't working well, we're not able to supply the blood and the nutrients to maintain the mucosa of our gut. We need to be looking at energy management within a triad of 3 hormones. And those 3 hormones are...
When you are dealing with a patient that comes in and they do have really high cortisol, maybe they're having some thyroid symptoms, some fatigue, some hormonal imbalances, that all goes back to the stress hormone cortisol. What is the first step in your approach?
I think that people who are really struggling with some of these fatigue syndromes, one of the most important things is, 1, make sure they're not engaged in intermittent fasting. 2 is to consider...
When you see patients using cofactors, nutrient cofactors to support thyroid function, they're trying to maybe avoid thyroid replacement for whatever reason. Why do you think that's really not doing the trick?
You can supply these cofactors, but if you're in a high cortisol state, I can tell you that...
Hello and welcome back to the Vibrant Wellness Podcast. I'm Dr. Emmy Brown, here with our wonderful co-host Melissa Gentile. Today we are so happy to welcome Dr. Scott Resnick. Dr. Scott is a medical doctor with over 20 years of experience, initially trained in general surgery and OB-GYN. He transitioned to functional medicine about 15 years ago to better address chronic conditions like fatigue, autoimmunity, and hormonal imbalances that conventional medicine often overlooks. Dr. Scott focuses on systems-based approaches to health, emphasizing nutrition, detoxification, and hormonal balance. His work is informed by his personal experiences with health challenges, and he aims to empower patients to take control of their health through education and targeted strategies. Today, we will discuss Dr. Scott's interest in revolutionizing modern medicine by assigning reproducible scientific systems to the practice of functional medicine. I can't wait to hear about his cutting-edge work today. Thank you so much for being here, Dr. Scott.
Oh, thank you so much for having me. This is really exciting, and I feel privileged to be able to speak to you and share my experiences and hopefully educate some people in the process.
Absolutely. And I want to start with going back a little bit. Obviously, you've had a fascinating transition from conventional medicine to functional medicine. Was there a pivotal moment? What was that pivotal moment when you realized that traditional approaches weren't really enough?
Oh, I think I probably had 2 pivotal approaches in my lifetime. And the first was actually developing a state of hypocortisolism after excessive stresses. And as so many of us, we go to our doctors and they do your complete blood count and the chemistries. And I think my doctor checked a TSH on me and it was 2, so most doctors would say, oh, you're doing okay, that there's nothing wrong. And I'd just been at the tail end of probably about a year of some pretty significant stressors. And what I did is I thought, I'd been studying functional medicine at that time, and I thought, I'm going to test myself and see. And 2 things happened. One is I found that with a TSH of 2, I had both free T3 and free T4 that were out of range, as in low, because as we know, states of high cortisol can lead to a relative state of hypothyroidism. And the other thing is that when I did my cortisol screen, I found that my cortisol was near flatline. So was it any wonder that I wasn't able to manage my body's health with normal cortisol patterns, and I was running on adrenaline. So I was in kind of like that wild and like wired and tired, followed by crashes as well. So that was one experience, and recognizing that conventional allopathic medicine really didn't have the resources to address what was going on with me. And then the other, as we discussed earlier, was in working with my pelvic pain patients. And so many women would come to me having had 1 to multiple surgeries for pelvic pain, and with no objective findings on surgery. And what I found is in working with these women that addressing their health with a more functional approach, and this is looking at their detox pathways, looking at their hormones, optimizing their cortisol and their thyroid, working with their gut primarily, and also working with different myofascial conditions that contribute to pelvic pain, that these patients would be managed and not require an additional surgery. So those were probably the 2 events in my life where I kind of said, wow, we need to start thinking about some of this stuff differently. But as you know, there's this big gulf between conventional training and conventional, allopathic medicine and sort of natural and alternative medicine. And what's interesting is that I had practiced as an allopathic doctor for probably 15 or 20 years. And I said, you know what, I'm going to look up allopathic in the dictionary. I'd gone to an allopathic medical school, did an allopathic residency training program, and I looked it up. And it turns out that allopathy is the use of a drug or a cream or lotion or something to offset a symptom.
Hmm.
So as we all know, there's nothing in this course of thinking that addresses what was it that precipitated the symptom. And even, the next step would be, what are the different things that we could do to reverse some of these steps and turn around some of these symptoms instead of just using an allopathic drug, which, as we know, might be useful to kind of, you know, bridge a gap or, help somebody through an intermediary state, but it doesn't really solve the problem.
Right. It's just one tool of many. There's so many other
Exactly.
tools.
And so what's interesting, there are, and what's interesting is as you begin to experience more patient care and some of the different testing which is available, like with Vibrant Labs, we begin to realize we can get different insights into the human physiology that then gives us different opportunities to make steps to turn those conditions around and get people better. So what's interesting is that this begs one question, which is, what is medicine? Is it the treatment of disease, or is it working to optimize health? And sadly, I think that we are trained in our conventional training to be thinking about health in terms of a state of disease, which means that you're all of a sudden you've got a blood pressure of 140/90. You've got a hemoglobin A1C of 5.8. Now you're sick. But whatever happened to those intermediate steps where somebody is on their way to developing a hypertensive state or becoming inflamed or pre-diabetic? And I think that's one of the places where conventional medicine misses the boat. It's like, the horse is out of the proverbial barn, so to speak.
We've normalized a lot of those maybe less loud symptoms when you're not fully in a disease state yet, but you're starting to experience fatigue or headaches or some digestive upset. I think we've really kind of just normalized that. And I think people
Right.
almost kind of expect it now.
Right. And we've created these artificial markers as well. So for example, once you're 140/90, you're hypertensive. What about when you were 136/86?
Great
Right.
point.
Or if hemoglobin A1C is pre-diabetic, what about when you're 5.6? So it's interesting that some of this thinking is changing. And one of the gulfs that to me is so interesting is this transition between the public becoming more educated about this. And it's almost as if a lot of the mainstream doctors are just digging in their heels and saying, this is the way that it has to be. And I can't tell you how many patients I've had go to their primary care doctors and say, can you please order a full thyroid panel? TSH, free T3, free T4, reverse T3, TPO, TG. Interesting, everything that your lab checks, right? And the doctor says, your TSH is 2. It's right in the middle of normal. It's fine. So I have actually in one of my files that I bring up all the time are my personal thyroid results, where my TSH was 2.5 and my free T3 and free T4 were out of range. So if all you looked at was the TSH, you'd say he's fine, but he's tired. He's constipated. He has no energy. His skin is dry. Hands are cold. It's okay. You're normal. So that's one of the things that so many of us, I think, are working to try to change, is to really allow people to have better insight into their healthcare through the use of testing that's offered at your lab and just different thinking as well.
Sure. And speaking of making these changes, Dr. Scott, I loved what you mentioned on your site. You say there is no single drug, supplement, diet, or herb that cures fatigue, autoimmunity, obesity, cancer, or any other complex medical problem. We can only get better by looking at constellation of systems.
Right. And that's a really good observation. And I guess one of my criticisms in part of even the natural and alternative, the holistic function, whatever term we're using, is that, have you noticed that in several cases, people are almost starting to use herbs in an allopathic sense.
Right.
You're not
Green
sleeping well,
allopathic.
take your theanine, take your GABA, take your tryptophan. And what's interesting is that paradoxically, we're those of us who are in sort of this natural realm are almost stepping back into this allopathic realm and just saying, we're going to use this herb or nutrient or mineral, whatever, to reverse the symptom. And I think we're losing sight of the fact that we still need to be looking at what are the different systems in the body that have become dysfunctional as a result of our environment, our diet, our stresses, our, all these different things that we know contribute to ultimately a state of human health.
Mm-hmm. And when you speak about addressing systems versus symptoms, you mentioned that you've discovered systems are related by function and priority. I'd love if you could elaborate on this a little bit.
Oh my gosh, yeah. So this is really interesting because what I've tried to do with my patients, and this is something I've developed over maybe the last 10 years, is to within the realm of natural and functional medicine, is to re-examine how it is that we look at human physiology. And what's happened is to this point, and I even think that this applies, within a lot of, alternative health practitioners, is we lump together, a diagnosis, whether it's depression or fatigue or anxiety or, diabetes, instead of saying, what are the different components that are contributing to that? And so what I've done is I've kind of developed a different way of looking at the way that our physiology is oriented. And I can walk you through that. It's actually pretty interesting. And it starts with, the first step is to recognize that we're operating with ancestral genetics. So, the genetics that have carried us through the last 500,000 years of being human, typically characterized by not a lot of day-to-day stressors, we're not always answering our cell phones or worrying about how many emails we have or the traffic jam when we're late for a meeting. Back in ancestral times, a real stress was running from a saber-toothed tiger, the infrequent battles that you got with the neighboring tribes. But even more prescient and salient on a day-to-day basis was the fact that we needed to find food. So, for a vast amount of time that the human animal has been on this planet, we have been hunter-gatherers, right? And it's really only been the last 10,000 years of the 500,000 years that we've been categorized as humans that we've been part of this agricultural revolution and growing grains and wheats and rice and things like that. So typically, I would argue that the human's greatest stressor is starvation. And what's interesting is that that's even reflected in, I think, the typical salivary cortisol patterning, right? So we've got the 3 to 6 a.m. cortisol awakening response, cortisol rises up. Why is it that we have this diurnal pattern of cortisol secretion? And I think it's because back in ancestral times, when we didn't have electric lights, we didn't have Kindles to read with at night. We had our last meal of the day, if we had a meal, at 5 or 6, and then went into our teepees or our caves to go to sleep for the night. So what happens? Between 6 in the evening and 3 o'clock in the morning, now we're talking 9 hours. Well, that's a state of starvation ultimately, because in the first 3 hours, we burn through our glycogen stores in our liver and in our muscles. So what happens? Our body knew that we needed to, while we slept, raise cortisol up to begin to mobilize some of these alternative fuel sources. And it's just interesting when you start to think about, have you ever wondered, why is it that cortisol spikes at 3 in the morning? I think it's in reflection to our human's primary stressor, which is a state of starvation. But we actually, historically, have gone through little periods of starvation 365 days a year as we went to sleep when the sun went down. 9 hours later, we burned through our glycogen stores. We release cortisol to help to mobilize these stores to keep our heart and our brain alive. So isn't it interesting, as I'm sure that, as practitioners, you've seen this, right? That how many people, have that 3 o'clock in the morning waking up, right? So if your cortisol is dysfunction, we've got a backup generator to help to raise our body's blood sugar, which is adrenaline. And I think that's what's happening to a lot of people, is that their cortisol is dysfunctional. After the only way to get to low cortisol state is having had high cortisol state. And someone who's in a relatively hypocortisol state over the course of the day, in the wee hours, doesn't have the capacity to raise their blood sugar. We resort to adrenaline. But you asked, how is it that we can begin to re-examine how our body works together? Okay, so what I almost envision is kind of a pyramid. Okay, so it's sort of equivalent to the Maslow's hierarchy of needs. So just imagine at the very top of the pyramid are our higher order functions. So these are things like cardiac health, cognition, and ultimately reproduction. Because if you're God or you're nature and you want your animals to reproduce, if those animals are under a state of high stress, starvation, migration, weight loss, all these things that we probably went through, it's probably not a good time to ovulate, probably not a good time to have to make plenty of testosterone. You're just in survival mode. So if you think that that's up at the top of this pyramid, the foundation is nutrition. And so the way I like to look at this is recognizing that, the way that we manage our nutrition is equivalent to making sure that all of our biochemical processes are not for want. So as you know, we need certain types and relationships of different fats. And we have too many of the saturated fats, the cellular membranes get too rigid. So we need our omega-3s, we need our omega-6s. They need to be in the right balance. We need our amino acids as well. And, as you know, there are 20 amino acids, 9 of them are essential. We need, minerals, we need vitamins, and all these things are to help to guide some of these enzymatic pathways. So if you think that on the very premise of any machine working well is you have to have all the parts to make that stuff work. And what's great is, through Vibrant, we can measure all those things, right? We can measure omega-3 fat. We can measure amino acids. We can measure trace minerals. We can measure red blood cell, magnesium. There are all these different measurements that allow us to get a better idea in terms of what is your biology, where is it deficient? So all of the other systems that we have in our body can't work well if you don't have the very basics. And that's fat for the cell membranes, minerals, vitamins, amino acids, phytonutrients, and a few other molecules that we need to kind of, make things work, like methyl groups and that sort of stuff. So once you've established a good foundation of nutrition, and what's interesting is you notice that I'm not talking about diet. This isn't South Beach diet or paleo or carnivore or high fat or low fat or anything like that. There's a distinction between diet and nutrition. So what we're talking about are the nutritional needs that our body needs to run well. Once we've established nutritional needs, and again, we're looking at this predicated on the fact that we are operating on ancestral genetics, is we need to manage energy in our body. So any living being, whether you're a tree, a bacterium, a human, a bird, a fish, what we need to do is we need to extract energy from our environment. We need to use some in the here and now to stay alive. But ideally, we want to store some for a rainy day. So that's when our energy sources dry up for a little bit of time. Remember, humans are basically built to live in times of feast and famine. So the way I see this is once you've established a nutritional foundation, sort of the next level that we need to look at is how our body manages energy. And I think this is something which is probably the most important thing that I share with my patients, which is we need to be looking at energy management within a triad of 3 hormones. And those 3 hormones are insulin, cortisol, and thyroid. Okay, so let's break that down a little bit. So as we discussed earlier in this talk, cortisol is primarily a stress hormone, right? But it's not stress like traffic jams and phone calls. It's stress of not being able to find enough food. It's saying, okay, so when the getting is good, right? We eat, our tribe killed an elk. There are lots of mangoes on the mango tree. We're going to fatten ourselves up. What happens? We fill up our liver and our muscles with glycogen. And then what happens? Then that extra glucose is converted into free fatty acids. That is then stored in our fat cells. And what an amazing adaptation for humans, because we know that fat has, it's 9 calories per gram or kilocalories per gram of energy versus 4 for protein. So if you're going to put on a backpack and you're going to wander through the desert looking for your next food source, it makes sense that if you've got a pound of energy that's going to bring you, 9 calories per gram as opposed to protein, which is going to give you 4, you'd want to stock up with this fat. So it's interesting to me that, that the recourse of extra energy, goes into fat storage. So that's insulin, right? So when we're eating, I would imagine because we're not eating and fighting or running from a tiger. So your insulin goes up, your cortisol goes down. So let's just say we stored all this extra energy. And then we enter a period of relative starvation. And I don't mean just like an overnight period of starvation that deals with our diurnal curve. Maybe you go for a week or so without really finding food. What happens? We stop making insulin. There's no reason to make insulin, right? Insulin's a growth hormone. We're not developing any kind of growth. We begin to secrete more cortisol, and cortisol then breaks down our muscles and our fat supplies. Breaks down our bones to liberate calcium and magnesium and sodium and things like that. So we start to scavenge our body. And as we know, cortisol is catabolic. So now you've got this yin yang between insulin and cortisol, where you've got insulin rising when there's plenty of food to pack that into storage, cortisol rising to break down those stored forms. Because remember, we're just trying to keep alive to reproduce, to pass on our genetics to the next generation. And then the last thing, which is so interesting, is that thyroid is kind of the last bit of this puzzle, because thyroid is our thermostat. So as we know, when we get into high cortisol states, we get into a relatively hypothyroid state. It affects the TSH secretion, the production of, T4 within the thyroid, and the conversion of T4 to the active form, which is T3. And under times of stress, as we know, we increase our reverse T3. So all these things together are working to tamp down our metabolism. So if we go back to when we're living in the caves, right? Let's just say that, your tribe didn't kill an elk and make the elk jerky for the winter. And, the groundhog didn't see its shadow and it's going to be a long winter. You're huddling in your cave, hoping to make it. What happens? Well, you're not making insulin because you're not eating anything. Your cortisol is probably in a higher state because you're in a state of breaking down your body's reserves. And then if you're God or nature and you want to keep this animal alive, do you want them in a hyperthyroid state or a hypothyroid state? And it makes sense that that would drive us into a hypothyroid state. So if you've got a finite amount of energy that you've packed onto your body, it makes sense that if we could, if we're huddling in that cave, we can exist at 35 degrees centigrade, at 97 degrees. We can exist with no libido, dry hair, dry skin, constipation, cold hand, cold feet, foggy thinking, because we're talking survival, right? So we're able to, under these high stress states, we get into a relatively hypothyroid state because that's what our ancestral genetics needed. Does that make sense?
It makes sense.
To this point. So I think the one thing which is really fundamental, and I think that anyone watching this podcast, what a really important thing is whenever we're looking at how our body is managing energy, these might be states of fatigue, anxiety, whatever, is remember to be thinking about insulin, cortisol, and thyroid as a collective unit. Once again, cortisol and insulin are sort of in this yin-yang dynamic with one another, and ideally they're balanced, right? And then you've got thyroid. So is it any wonder that someone like myself, who got into a first hypo, then hypocortisol state from all my stress, would be in a relative state of hypothyroidism. It's just our body's natural genetics saying, hey, his stress, our cells don't know what's driving that cortisol. Our cells don't know if it's just in our minds, if it's a traffic jam, or if we're really starving, we're fighting a saber-toothed tiger. So what's interesting is that we respond to these in an adaptive state that works great in ancestral times. When it starts to fall apart is in our modern life with all these gratuitous calories and carbohydrates. Because when we get into a high cortisol state, the other thing that cortisol does, as we know, is it inhibits the function of the insulin receptor. So now we start getting into this vicious cycle where high cortisol, we're eating all kinds of unnecessary carbohydrates. Our insulin isn't working well. If our insulin isn't bringing the glucose into the cells, where does it go? It goes into our free fatty acids and our fat. That creates higher levels of inflammation and high levels of estrogen and that sort of stuff. And then it's sort of off to the races of all these chronic conditions. So to this point, you recognize that we're not talking about any kind of diagnoses. And we sort of began this talk saying that one of the shortcomings, I think, is that even in the natural and alternative field, we're still, using herbs and nutrients and some of these interventions in an allopathic sense. And what I'm challenging everyone to do is to start to think differently and to, look at how our body is arranged from sort of this choreographed physiology. So nutrition's on the foundation. After that, we need to manage our energy. And then after that, the next thing that we need to do is to manage our barriers. And you're probably thinking, barriers? What's he talking about? Well, it turns out that, we live in a world that's filled with all these microbes. But yet we still need to engage with our environment. We need to, I'm drinking a little bit of water here, and there's probably tons of bacteria in that water. We eat 2,000 pounds of food, and yet there's a whole group of microbes that want to dine on our glucose and our amino acids and our fats. So what happens is we need to maintain semi-permeable barriers to the outside world. And our primary barriers are our skin, right? And our gut and our lungs. And then you can even take it a step farther and say, there's some research that came out in Harvard a couple of years ago that shows that in the subendothelial barrier, that there are antigen presenting cells that work very similarly to the dendritic cells in the gut, or the Langerhans cells in our skin. So isn't it interesting that, that said that 70% of our immune cells are within 1 centimeter of the lining of our gut? Our immune system is protecting our barriers. And it's in a dynamic state of saying, yes, some of these bacteria that live in our gut, for example, are friendly. They're beneficial. They make vitamins. They break down our fiber into short chain fats. But then there's also some of these bacteria and parasites and yeast that can act like pathogens. It's just so once we've established a state of balanced energetics, then we can maintain our barriers. So let's take a step back and look at this, because what happens when we get into a high cortisol state? Cortisol diverts blood away from the gut. It diverts blood away from the skin. So is it any wonder that in a high cortisol state, remember, you're not eating, so you're not taking food into your gut, for example, that with high cortisol, you begin to break down this single cell mucosal barrier between 70% of our immune cells and effectively the entire outside world. Anything that we eat or drink, could have a parasite, a bacteria, a yeast, some kind of microbe that would be, potentially could affect our health. So as we become dysfunctional with cortisol, is it any wonder that some of these barriers start to break down? We get dry skin that begins to crack. We have a gut mucosa that doesn't work quite as well. So I like to look at the gut and the skin. I mean, clearly they have all the functions that we know about in terms of digesting, absorbing food, but they also serve as barriers to the outside world. And I think one of the things which is driving so much autoimmunity in today's modern world, I mean, I've read statistics that 1 in 11 people have an autoimmune process in the United States, probably most commonly Hashimoto's, right?
Mhm.
But, so 1 in 10 people it has autoimmunity. Why is that? It's because we're nutritionally deficient. We can't maintain our energetics. When our energetics aren't working well, we're not able to supply the blood and the nutrients to maintain the mucosa of our gut. And while we're at it, as we know, the gut mucosa regenerates itself every 3 to 5 days. I mean, that's a pretty highly energetic process. You can see that if we're in a high cortisol state, we're diverting blood from our gut. We're not able to maintain this recreation of this important single cell membrane that supports us from the outside world. And now our immune system's getting bombarded with all these different signals. All right. Ancestrally, we had 5 to 10,000, molecules that were the plants and foods that we ate. And I think the last count is something like, 6 million different chemicals that have been invented, so
Wild.
that's where we start looking at some of these, the plastics and the pesticides and the herbicides and, all these, hormone modulating compounds that are affecting our immune system. Okay, so we're marching our way up kind of this pyramid, right? So once we've maintained good barriers, then the next step would be our ability to detoxify. And really, we detoxify across these barriers. I mean, we sweat, we conjugate toxins and pass them out in our stool. We need to be able to take the water-soluble ones and pass them out through our kidney. And the lighter than air toxins, probably the most notable is carbon dioxide, right? We breathe off through our breath. So, what you can see is we're kind of stacking up these different systems in order of priority. And I think that one of the shortcomings that I see in with a lot of practitioners, and as you know, it's sort of the Wild West in natural and alternative medicine, right? You can go to, somebody who's a detox specialist, another person who's a mold specialist, another person who's a thyroid specialist. But we need to be looking at this whole sort of congregation of components to make up human health, sort of coherently. So what I would do with my patients is kind of sort of draw up this little pyramid and say, look, this is what we're going to be focusing on based on your history, based on your laboratory testing. We're going to be addressing this. And then what I would do is I would take this triangle and I'd make a little tiny little dot under the middle of it. And I would say this represents inflammation. And I'd say if you have a little bit of inflammation, this whole structure that we're building stays in balance. And then I'd draw a big circle and make the pyramid kind of look sort of cattywampus, tilted off to the side. And I said, this is what happens when we get inflamed. And as we know, all these different systems start to fall apart. Our immune system doesn't work so well. Our gut doesn't work so well. Our insulin receptor doesn't work well. All these different components that we tried to, carefully build into a coherent working whole start to fall apart. So that's the Scott Resnick kind of view of how we can look at health a little differently. And what it does is it moves away from just talking about diagnoses to organizing this in almost like hierarchical systems. Because as what I've hopefully expressed to you is that we need to establish these underlying supportive systems in order for our higher order processes to work. So let's say how are we doing on time? We're doing okay. So let's just
We're doing okay.
let's just take this even a little farther. So let's go back to this ancestral human. We're living in the cave. Cortisol is high. It's doing what cortisol does. It's metabolizing our body to liberate glucose to keep our brain alive. We're in a relatively hypothyroid state. Remember, I told you that the very top of this pyramid is our ability to reproduce and think. So it makes sense that if you are under a lot of stress and you're an ancestral human or even a modern day human, that if you're trying to keep alive, is that a time for a woman to have a nice ovulatory cycle and lose 80 cc's of blood and iron and, cell membranes onto the floor of her cave? Of course not. So is it any wonder that as we get under more influence from these stress-based processes, that we see less effective ovulations? And, the reproductive endocrinologists have known this for 30 years. I mean, we've known that a woman who, runs 6 miles a day has a really high possibility of just being anovulatory. Hypogonadotropic hypogonadism. We just don't make the FSH and the LH because that's a big stressor. But, running 7 miles a day is a big stressor on the body. So what's interesting is that as these processes start to fall apart, as we get more inflamed, as we get more hypothyroid, as our insulin receptor doesn't work as well, we start to see ovulatory patterns that don't go as well. And is it any wonder? I mean, we all know that hypothyroidism contributes to anovulation or sub-effective ovulation. Insulin dysfunction contributes to anovulation. And that's why so many people who are, have sort of a polycystic ovarian syndrome picture are put on a insulin sensitizing agent like metformin. So when I think as we kind of like build up this process, I think it becomes most apparent when we look at women so many women are in sort of a state of estrogen dominance. But as we know, that's not necessarily estrogen dominant, just more progesterone deficiency, right?
It's all the
So
stress.
yeah, from all
Yeah.
the stress. And I think the important thing is to recognize that we're running on ancestral genetics. I mean, our cortisol, our thyroid, our insulin are still operating as if, we're hoping to, find that next tree or dig up that next potato or hopefully catch a fish to kind of keep ourselves alive. Our body was not made for having high stress and unending gratuitous calories and carbohydrates. And that's really where so much of our physiology and chronic disease comes from.
So I do have a question. When you are dealing with a patient that comes in and they do have really high cortisol, maybe they're having some thyroid symptoms, some fatigue, some hormonal imbalances that ultimately, from what it sounds like, kind of all goes back to the stress hormone cortisol. What
Right.
is kind of the first step in your approach? I know you said nutrition is kind of the foundation of everything. What
Right.
would be like an example nutrition plan for someone that's trying to transition like out of that high stress state?
Well, that's a really good question. And I think that probably the first thing to do with all of medicine is get a good history and physical. Because I can tell you that in my professional experience, some of the most nutritionally deficient people are the vegetarians and vegans. And
Oh,
we know that we can manage diet well with we can manage nutrition well with those diets, but it takes a little more work. So I think that the first thing to do is to take a good history. And then I think it's also important to know where that person's cortisol pattern is. And as we know, the best way to look at that is with the 4-part salivary cortisol test to include DHEAS. And so I think once we have that information, I think then we can begin to say, alrighty, are you in a high cortisol state or are you in a low cortisol state? And I think that there are different interventions to try to address those things. One thing which is interesting is how many I've taken care of so many patients who are like the hardworking mothers of 3. They're going to Pilates, they're going to yoga, they're racing around, they're starting a business, they're working so hard. And what else are they doing? They're doing intermittent fasting, right?
yeah.
So
It's
that's
become such a
basically
big trend. It's really, gained a lot of traction, I feel like, over the last several years.
right. And don't get me wrong. There's a lot of science that shows that intermittent fasting, can definitely drive different genetic patterns that basically take out the cellular crash, so to speak. But it's not appropriate for someone who's in a hypothyroid state because they need to be managing their energy with diet. So one of the first things that I'll do with people who are suffering with cortisol dysfunction is to work on sort of tailoring a diet that's going to keep glucose in their bloodstream. And what's ironic about it is I find that a lot of people start feeling better while you're peppering in small amounts of carbohydrates over the course of the day. So I am in no way a carbohydrate nihilist. I mean, there's no question that our brain can run on ketones, it works, but it much prefers glucose. So I think that people who are really struggling with some of these fatigue syndromes, one of the most important things is, one, make sure they're not engaged in intermittent fasting. 2 is to consider, their nutritional state, make sure that one of their stresses is not because they're profoundly deficient or excessive in a nutrient. And then finally use diet to try to level out this cortisol response over the course of the day. Because remember, when somebody gets into a hypocortisol state, cortisol and adrenaline are known as counter-regulatory hormones, meaning that they oppose the effects of insulin. So if your cortisol is not working well, then the other hormone that you have to help to manage your blood sugar over the course of the day is adrenaline. And how often do I, when I'm talking to patients, do I say, so doc, I'm tired all day long, but man, I go into these fits of like frenzies where it's like I'm looking for food, I'm racing through the office looking for donuts or cookies, but also I get so anxious and I scream at my kid for spilling milk. My belief is that person might be, if they don't have cortisol to help to maintain their blood sugar, and they're not managing a diet that maintains glucose in their bloodstream over the course of the day, they're using adrenaline. And as we talked about earlier, I think that wakes people up at 3 or 4 in the morning. So if you've got a flattened cortisol curve, you're not able to generate that cortisol awakening response between 3 and 5 in the morning. You get into you manage that blood sugar to keep your brain alive with our backup generator, which is adrenaline, which is kind of energy's wild child, right? Cortisol raises goes up like this, nice gradual increase. Even when under a stressor like you're getting into a fight, it still takes 2 to 3 minutes start to raise cortisol. Adrenaline goes up in just a second. So anyway, so that's my first. That's how I like to approach things with patients with whom we are dealing with, stress and fatigue, and because I think a lot of time it has to do with the dysfunctional cortisol patterns.
What are you thinking as far as, if I'm hearing this correctly, Dr. Scott, doing a little bit of maybe complex carbohydrate for these folks they're burnt out, they're
love
running
it.
on adrenaline,
Yeah,
right?
that's probably the optimal
Yeah.
type of carbohydrate, right? So I think that's a great idea. So there are a lot of different options that we can use, whether it's sweet potatoes or brown rice.
Right.
It doesn't need to be gummy candies or something to raise
course.
your blood sugar. So I'm a big fan of that. I think it's a great idea.
Well, it's just so helpful for you to say, of course, I was thinking sweet potato. We're thinking whole grains as tolerated. Fiber, right? We need fiber. So important. But there's so much fear around carbohydrate, right? And this is just
Right.
contributing to the stress that you're talking about. It's this vicious
Right.
cycle.
And what you're bringing up is interesting, because there's one of the things that my personal mission and professionally is to try to dispel some of the noise that's out there. I mean, as you know, like in Internetville, there are so many people that have so many different plans and diets and supplements and programs, but there doesn't seem to be like one coherent way of looking at this. And my belief is that, provided that the medical landscape is the Wild West, where the medical medium has as much credence as Mark Hyman, the mainstream powers that be are never going to look at what we do and begin to change their thinking. And I think that what we have to do is we have to, at some point, collectively, is begin to agree on a different way of approaching some of these problems that is based in some structure and is based in good science. And I think it's so easy for patients to kind of pinball around to this medical doctor who does this, and then they go to a chiropractor who gives them 20 milligrams of iodine a day to fix their thyroid. And somebody else is recommending the bone broth diet and coffee enemas, and people just don't know where to go. What I hopefully presented to you by walking through this sort of pyramidal approach is what I feel to be a coherent way to approach things. And I can tell you that what I just shared with you works with any medical condition that I've encountered, short of something that's genetic. So you can look at autoimmunity, hypertension, diabetes, cardiovascular disease by saying, what's your nutritional status? How do you manage your energy? How well do you maintain your barriers? Are you able to detoxify? And then finally, what are your hormonal levels?
Yes. Oh, I love
And it makes sense that we look at hormones last, because if you can't detox and you've got really bad intestinal permeability, you're not able to conjugate your phase 2 products of detoxification. Should it be put on hormone replacement therapy? Maybe not. Depending on the person's degree of symptomatology, of course. But I think we need to be thinking about how well we're maintaining these other aspects of our physiology to support the more complex, higher order processes like reproduction and cognition and detoxification.
And really just for best outcomes, even if somebody, struggling with just a little bit of whatever fatigue, hot flashes, if the foundations aren't there, you're not going to get the best outcomes.
Yep, exactly. So I'm with you on that. I think it's all a question of optimizing how well people do.
And I think with your approach too, I do have a question on thyroid function. So obviously when we're looking at the full picture here and like going through the different, the hierarchy that you just explained, and going back to stress hormones and cortisol and how can we approach this systemically, do you ever use any like thyroid supporting, whether it's a prescription, like a medication, like a prescription for T3 or T4 to help mitigate symptoms? Or do you always go back to, let's just do this a natural way and let's see how we can support the whole body?
If anything, I tend more towards using medications to help to remedy things. And in my experience, I think that kind of the sweet spot for men and women is to get their free hormones in the 50th percentile or above, or maybe ideally in the upper tertile of a laboratory's range, almost irrespective of the TSH. And I can't tell you how often in my practice I've seen women begin to ovulate effectively and get pregnant. It's almost like the lights come on for so many people when you're working with the thyroid. Now, don't get me wrong. I mean, I think it's important to know, to consider what someone's iodine levels might be, to be working on their cortisol in the background. But I think that, and on the flip side, I've had a number of patients who've had pretty significant hypothyroidism, maybe like TSH of 7 or something like that, who went off and tried to do, they're taking selenium and they're taking, they're taking iodine and, tyrosine and all these things to support thyroid hormone production. And they come back 6 months later and their TSH is 9. Like, help me. So I think that it's funny. I think in terms of the medications that I prescribe, really it's thyroid hormone, bioidentical sex hormones, and rarely an antiparasitic drug if somebody is unable to tolerate the black walnuts and the different herbal ways of approaching things, or depending on what the parasite is.
And with the thyroid medications, is it usually temporary, or is this something that you're okay with long term for some patients?
Oh, I'm fine with the long term for people. Yeah,
Wow.
I mean, if they're doing well. Here's an interesting aside. As you know, conventional doctors are terrified of thyroid replacement therapy because I think on the first day of medical school or naturopathic school, we're taught hyperthyroidism causes arrhythmias, which is true. If you've got something like Graves or, you're way overdosed on your thyroid medication, you can have arrhythmogenic events. But what I found in my practice, because so many of our cardiomyocytes, the cells that are involved in the contractile processes of the heart, are very densely packed with thyroid receptors. So, and there's so much data coming out about, sick sinus syndrome and myocardial infarction that's associated with low levels of free T3. What I found is in some cases that when we optimize people's thyroid hormone, their heart rate comes down. Why is that? Because now you're supplying these cardiomyocytes, these contractile cells, with enough thyroid medication, and they're pumping more effectively. So, you don't need to be having 80 heartbeats a minute to deliver the blood to your body. Now you can do 70 heartbeats a minute. So with all my patients, I would have them follow their resting heart rates and their basal body temperature whenever I did any kind of thyroid replacement therapy. And I've used a lot of thyroid hormone in my practice, and I think it's really valuable.
I have to ask Dr. Scott, you mentioned just prior, when you see patients using cofactors, nutrient cofactors to support thyroid function, they're trying to maybe avoid thyroid replacement for whatever reason. Why do you think that's really not doing the trick? Why do you think, I think that thyroid replacement is going to be the best bet?
I think because they're missing the bigger picture. Because cortisol is a locomotive, right? If your cortisol is dysfunctional, like I said, it's working centrally on your TSH, working in your thyroid cells, and making thyroid globulin, conversion of T4 to T3, receptor function, as well as reverse T3. So I think that you can supply these cofactors, but if you're in a high cortisol state, I can tell you that's not going to turn things around. I think somebody's in let's say somebody's in the Midwestern United States and they don't have a ton of stress. And as you know, there are regional areas in the country where we have nutritional deficiencies. So iodine is low in the Midwest. Selenium is deficient in the Northeast. So I could see how, if somebody maybe was iodine deficient and maybe had a mild goiter or something like that, you could turn that around by measuring their iodine and then replacing it in a sensible way. And when it comes to replacing iodine, I've seen so many patients who are, getting iodine that's recommended to them in kind of the 10, 20 milligram a day dosages of iodine. And there's something known as the Wolff-Chaikoff effect. And this is something that's been known since the 1950s, in the fact that high levels of iodine actually suppress thyroid function. So here are, I don't think we need more than like 800 micrograms of iodine a day, maybe even 500 micrograms. And I've had patients who've been put on 10, 20 milligram doses a day, and that's exacerbating their hypothyroidism.
And Dr. Scott, I do want to get into a little bit about pelvic pain and how you address pelvic pain without the use of surgery, with kind of your background. So where do you usually start if you have a patient that kind of comes in with pelvic pain? What conditions are you typically associated with it? And what are some of those like functional approaches that you use, such as like diet, hormone replacement? Like, where do you start with these types of patients to avoid putting them under surgery?
We might need to make a whole additional podcast to talk about this. Yeah. So once again, it's multifactorial, meaning that there are a lot of factors that contribute. And the conventional allopathic or surgical mindset is that we're just going to drop a scope. We're going to cut out some scar tissue. We're going to remove a couple little blebs of endometriosis and people are going to get better. What I've found is that for most women, there are a lot of different factors that come into play for pelvic pain, and not the least of which is an emotional state, right? So a woman has a history of abuse, sexual trauma, perhaps, that can contribute to, a lot of symptoms. But I found that what's really interesting is when you start to look at pain syndromes from this visceral and somatic interplay. So, the visceral nervous system are all the things that we can't control. So I can't control how quickly my bladder fills or my heart rate or whether my belly's grumbling or something like that. And then the somatic nervous system is, the things that we can choose to move, like my hand or my vocal cords. And what I found in pelvic pain is that there's a lot of overlap between these two because all these nervous signals interface on the spinal cord at the same place. And there's like a splay, there's overlap. So there are a number of different musculoskeletal referral patterns that go both ways. So I truly believe that, a woman who's suffering with pelvic pain, if she's constipated, for example, and she has a lot of stretch on her colon, that's activating some of these pain signals. Those pain signals are feeding back to the spinal cord, and the spinal cord gets a little confused. So I think that, as we humans were developed, we learned to utilize our spinal cord more efficiently. A classic example is a heart attack, right? So that's a visceral organ, right? But what happens when you have a heart attack? You get jaw pain, you get left shoulder pain, you get left arm pain. So it's almost as if some of these nervous pathways that are reserved for, sensation in that part of the body, if you're going to have one heart attack in your life, it's okay if we kind of, jump on those pathways to utilize them. And what I found is in pelvic pain that we need to be thinking about bladder function. We need to be thinking about gut function. So unquestionably, if a woman has pelvic pain and she comes in and says, "Doc, I have a bowel movement every 3 days," the number one thing we're going to do is start to, get her on some dietary or nutritional treatments. Psyllium's a great idea, to begin to get her stooling on a regular basis. Another visceral component of pelvic pain is the bladder. And I can't tell you how many people or how many women I've taken care of, and actually men for this, who have almost like an interstitial cystitis type picture, where they're like, "Doc, I just get up every morning and I have my cup of coffee. I have my Diet Coke." I've had so many patients who eat these different foods, whether it's tomatoes or sodas or caffeine or peppers, some of the nightshades, as they're filtered through our system, some of that pain is perceived in the bladder. So what happens is if you don't take a good history and do a good examination, and that's what I want to get to last, because that's, I think, one of the more interesting things, you might miss some of these things. The other thing that contributes to a lot of the pelvic pain is myofascial and musculoskeletal referral patterns. And once you start to look for them as a gynecologist or just as a primary care doc, you begin to see that there are so many pelvic pain patterns. So, for example, the bladder refers to just over the pubic bone. The colon typically refers to pain being perceived like above the umbilicus. Ovaries can refer to one side or the other. And I had a big practice of pelvic pain patients who had myofascial pain that was reflected in their abdominal wall just above their pubic bone. And you would find these trigger points where you could, kind of press down and it would reproduce their pain. I would inject these patients with like a combination of local, long and short acting anesthetic. And they'd be pain free for a month. A month later, they come back to the office, but that allowed them to get through their activities. They could make love with their partners. They could go to work. They could, play soccer, whatever it is they wanted to do. And the important thing is to actually, I don't want to just, while we're talking about this, is I think the exam is a really important thing. And I was fortunate in the fact that in my residency training, I trained with a doctor by the name of John Slocum at University of Colorado, who was one of the early pelvic pain specialists. And when I would do an examination on a woman who had pelvic pain, I would first get a Q-tip and just touch her vulva and place like the Bartholin's glands and the Skene's glands and say, is this hurting? Is there a vulvodynia component to the pain? And then as part of a vaginal examination, I'll just take one finger and really gently insert it vaginally and start to feel some of the supporting muscles that support the introitus. Maybe it's the obturator internus. And then what I would do is slowly bring my finger up to examine the neck of the bladder and then the bladder. Can't tell you how many patients with pelvic pain who've had surgeries, who've had, gun, narcotics, whatever, is you do an examination and you press on the bladder and they're like, "Doc, that's my pain right there." Okay. So now we're going to talk about some of the things that we can do to, to help to maintain your bladder health. Primarily it's getting off some of those foods I was mentioning. But there's some other supplements like D-mannose that has a, good amount of research as well, supporting its ability to kind of suppress bacterial growth in the bladder. only after examining all these other things and taking a good history would I do an examination to examine, the cervix and the uterus and the ovaries to see if that was a contributory thing. And I think that's one of the things that is unfortunate. Oh, and one last thing I want to mention is there's a really valuable test, which is known as Carnot's sign. It's CARNET. And what it does is it isolates the abdominal wall from the visceral organs inside. So I'd have a woman who was lying down on the bed. I'd say, do you like a little bit of a crunch? And then if she does a crunch, and then you're kind of pressing like over her pubic area, lower abdominal wall, and she's like, doc, that's my pain right there. Clearly that's not coming from her viscera. That's not her ovaries. That's not her uterus. That's not her bladder. Because as she tightens up her belly wall, you're creating kind of like an interface. So that there's a good example of how that might present as a referred pain pattern or trigger point. And the last thing is that these trigger points refer around to the back as well. So gluteal muscles, iliopsoas muscles. These are other things that in my practice I would examine. Iliopsoas is the most powerful flexor of the hip. The glute muscles are the extenders of the hip. And all of these somatic muscles, because of the way that they feed back to the spinal cord, can contribute to the perception of pelvic pain.
I imagine pelvic floor therapy is a huge referral
Brilliant.
for you.
Yeah, absolutely. Yeah. And I think we're fortunate because when I started, when I finished my residency training in 2001, pelvic physiotherapy was not really in existence. That's what we were doing in the office. Because I'd worked with John Slocum and he taught me about these muscles and I started to look for it. And with so many things in medicine, if you don't look for something, you don't find it. Right. And that's the beauty of laboratory testing, for example, or even good clinical testing, is to say something has to enter your mind. And then you can say, then I need to look for it. If it never enters your mind, you're never going to look for it.
Right. You don't know what you don't know, especially if you're just focused on using medication,
Yep, exactly.
and symptoms.
You don't know what you don't know. And for the place this is most, I guess, blatantly seen is in the management of pelvic pain. Because what I just expressed to you in terms of the thought processes and the examination, and then even some of the treatment possibilities, I can tell you that 97% of gynecologists don't know that, which is unfortunate.
Yeah, absolutely. Well, speaking of all of these ways to properly assess patients, Dr. Scott, I would love it if you could share a case study of yours to review some of these concepts and understand them a bit better.
I've got a great study for you.
Okay.
So I had a woman, I was living in Chattanooga, Tennessee, and I had a woman come into my office, and she's 37. She'd had a recent acrimonious breakup from a boyfriend in Colorado. She'd moved across the country to Tennessee, had started a new job. Her stress was out the roof. And she came in looking like she'd been in a boxing match.
Wow.
Her face was puffy and swollen. She had horrible rashes on both of her arms, such that when she closed her hand to make a fist, it would actually crack. Okay.
Oh, wow.
She'd been to the dermatologist. They put her on some steroid creams, and they're like, "Oh, you're just gonna have to take the steroid creams," right? So she looked for a functional approach. In taking her history, I found out that she had been a lifelong vegetarian vegan. And when we measured her serum B12, it came back like 170 or 200. It was very, very low. Additionally, when we measured her omega-3 index, it was something like 1.2%,
Wow.
2%, because she hadn't paid attention to supplementing these things. So, and I can't remember where her cortisol was, but so what we did is we started to address her health from working on her stress response, getting her on some good adaptogenic herbs, to help to, just for their adaptogens, help to modify that response. But most importantly, we worked on her nutritional state through supplementation. And sort of the postscript of the story was, she left my office after a couple of visits, and maybe 6 months later, I was in the local Whole Foods, and I sort of see from the Whole Foods this like gorgeous blonde woman, and she's like looking at me and coming straight towards me. It's like, who is this? And she walked up and she goes, "Look," and she holds out her hands like this. And she goes, "Yeah, there's like one little patch that's remaining here. I could see," I had no idea who she was until she came up and she held out her arms. And I was like, of course, it's the woman who'd had these horrible rashes, but she'd had so much inflammation from these processes. And I think what had happened is that her stress was high. She was nutritionally deficient. She wasn't able to maintain that mucosal barrier. I'm pretty sure that she had some food sensitivities. That's it. She did have some food sensitivities, and one of them was almonds. So as a vegetarian vegan, she used almond milk and almond flour
Probably
and
all
almond
day,
paste and almond
every
butter
day.
and ate almonds. And one of the food sensitivities that she hit really, really high on was almonds. So here's what's happening. Her stress is high, cortisol is high. She's developing a less functional mucosa in her gut. She's infusing on a daily basis an antigenic stimulus of her immune system, and her immune system just went wild, creating all this swelling in her face and ultimately all this scarring in her hands. And if there's any questions, about the way that the immune system in the gut influences our skin, you don't have to look any farther than celiac disease, right? Where one of the defining findings, is or what is it called? It's
Dermatitis herpetiformis.
herpetitis dermatiformis. Right. We got it. So, here it is where it starts in the gut. You're being exposed to the antigen, which is gluten or gliadin, and its manifestation is on your skin. But the thinking of allopathic medicine would never think to make this association, but we make this association. And so that's really one of the stories that I think like sticks in my mind. And really the funny part was just seeing this like absolutely gorgeous woman coming bounding to me across, because I didn't recognize her because she looked so, puffy and so inflamed and so, all these scoriations on her skin. So there's an example, and it takes time, as you know, right? So it's just a great example of the way that taking a good history, doing the right testing, identifying the things that need to be replaced and replacing them. There's a great adage I heard from a doc named Elder Taylor, who said, you can't manage what you can't measure. So I'm a big fan of measuring things, making modifications and measuring them again. And of course, we've got Vibrant Labs. It gives us, just about everything that we'd ever want to measure. So
I imagine micronutrients and stool testing are probably two of your go-tos. Do you have any other go-tos? And correct me if I'm wrong, but for foundational initial stage testing.
Cortisol, and thyroid and insulin. So I just think that those hormones collectively weld such a big stick and have so much influence on downstream aspects of our body, that those are, I think that's the best place to start. And then depending on someone's history, their exposures, their dietary choices, then you can start to piece out some of these other things. It's like, oh, you've been on proton pump inhibitors for 5 years. Let's check your magnesium and your zinc. Oh, you've never eaten fish in your entire life. Let's look at your omega-3s.
Of course.
So I think it's important to, but really in my experience, I would say that 85% of my patients, we'd operate in kind of like those lower two tiers. So nutritional status, then the energetics, which is insulin, cortisol, and thyroid. And I would say that in identifying those things and reconciling them, I would say that 80% of people get better.
Amazing.
Beyond that, you can start to look into the gut and look for pathogens and look for toxins and look for mycology and things like that.
Dr. Scott, you articulate this so well. I feel like this episode is just going to be a really good resource for people, especially if they're feeling stuck in their own health journey, and just kind of giving us a foundation to work with. And as you said earlier, it's like this process that you take your patients through, it works for almost any disease or any chronic disease that you're seeing in patients as well.
Works for anything, right?
So,
well, hopefully there's people that watch this are going to, will have a little more information by which to help to guide their own medical care. I mean, one of my missions in life is to empower people to be best stewards of their own healthcare, because my belief is the way that we're going to turn around medicine is by having, people who become well educated, have done the right kind of testing, going into their doctors and saying, my TSH has been 2 for years, and I've been telling you that I've had this litany of hypothyroid symptoms. I finally had somebody order a full set of labs on me. My T3 is out of range. My T4 is out of range. Please put me on thyroid hormone. And it turns around people's lives.
I love that. Empowering the patient to kind of speak up and raise their hand and be like, hey, listen, I'm not feeling well. Let's dig a little bit deeper. So
right. Exactly.
I love that. And thank you so much for being so articulate and just explaining this in such a way that is really digestible, because I think it can be really complicated to start diving into all the different hormones and how they kind of interplay with each other. But if there's anything I take away from this episode, it's pay attention to cortisol. It seems like it's at the root of a lot of these issues here.
Pay attention to cortisol. Start to think about our health in sort of a stratified fashion. As I said, if your gut's not working, your skin isn't working well because you're so hypothyroid, taking shallow little breaths, You're not detoxifying across your gut, your skin, or your lungs. So before we put someone on a detox process or, program, we need to be thinking about optimizing some of these underlying things. And hopefully what I have found in working with patients is what I just shared with you is hopefully a relatively simplified way of looking at health. We go to 4 years of naturopathic school, 4 years of medical school. We learn all the minutia, and I think it's easy to get, what was losing sight of the forest for the trees.
Yeah.
So I think what I like to do is to sit with the patient and say, look, your trees are 15 years of veganism. Your trees are massive stress that's out the roof. Your trees are the fact that you eat at McDonald's 4 days a week. Okay, let's start to take some of those things out. And then, the forest, the more overarching health picture begins to get better in time.
I have to ask Dr. Scott before we wrap up. I'm a visual person. Is there an infographic that you have or a book with illustrations of this hierarchy? Because I would love to see it, to even laminate it and recommend to providers to use it as a teaching tool.
Why don't we do this? I can provide you something sort of offline. So if I can get your email address, I'd be happy to provide you with an infographic that I have that just kind of simplifies this.
Absolutely. We'd love to put that in the show notes if that's okay with you too.
Yeah.
That'd be great. Yeah, absolutely. I'm trying to share this thinking with other people, and ultimately, at a certain point, because we didn't talk about this as well, but I was actually brought up to Canada to be a chief medical officer for a medical technology company that is using computers to think like functional medicine doctors to objectively demonstrate that this medicine works. I think that the only way that we're going to ever change medicine is with objective data. And as long as natural and alternative medicine is kind of this wild west of this person does this person does that. So when we have sort of a coherent way of looking at health, which is what I shared with you, computers just chew that stuff up. And it's really easy for them to look at the data and then reiterate it. And at a certain point, I think we're going to have so much data that this kind of thinking is beneficial for people and gets people better. Really, I'd love to be able to see this offered through insurance policies at some point, that we could do natural and alternative medicine, because it's not alternative. That's the crazy thing about it, is there's so much science out there. There's thousands and thousands of, studies that demonstrate that in correct applications, this approach to medicine, I think, is in many ways better. It's just that's pretty intimidating if you're, Johnson and Johnson or, one of these pharmaceutical labs. So at a certain point, if we can aggregate this data, we can demonstrate unequivocally that people are getting better with good objective data. At a certain point, medical schools are going to have to start teaching this to their medical students. Insurance policies at a certain point are going to be like, wow, there's good data to show that this is better. And you know what? Putting someone on a sort of a functional approach to health is a lot cheaper than a visit to the cath lab. And, things are going to change. And I heard one time years ago that like the typical time in medicine between discovery of something and the institution of that in common practice is something like 18 or 20 years. So I think that we are starting to hit that 20-year point now of, more and more people recognizing the power of functional medicine.
Gosh, I hope
and
so.
I think we're getting close to that tipping point, but it's going to take good data, and it's going to be like, because as on this podcast, you have a lot of really powerful voices in this community. I think these are the people that we need to be listening to. And, but as we know, there's so much noise on the internet. So it's that signal to noise ratio. And I think that, what you're doing is helping to bring that signal to more people. So thank you for doing that.
And thank you, Dr. Scott, for taking the time to be on the podcast today. And I'm sure our listeners are going to want to learn more about you, read into your background a little bit more, see what other resources you have for us. So where can our audience find you online?
I have just a blog site, which is scottresnickmd.com. Doc Scott MD is an Instagram page that I have. Working on getting that set up a little bit. I've been a little predisposed for the last 6 months doing some other things. And Scott Resnick, I've got a YouTube channel as well. And it's just, they're just short videos kind of going over some of these things we've talked about.
Amazing. We'll be sure to link these down in the show notes for you guys.
Yeah, that'd be great.
That are listening so they can find you online. And until next time, wishing us all vibrant health and wellness.
That's great. Thank you so much for your time. It's been good meeting with you.
Of course.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.